When the extraordinary emerges for millennia, human beings have experienced states that defy ordinary explanation, from the ecstatic visions of ancient shamans to the transformative meditations of Eastern Wanderal mystics. In these sacred moments, the veil between the self and the cosmos seems to thin, allowing a vibrant surge of inner light and insight. Yet in our modern era, where powerful diagnostic tools attempt to frame every deviation as pathology, these very experiences are at risk of being dismissed as merely symptoms of psychosis. Can the profound transformation of a Kundalini awakening really be mistaken for a mental disorder? Does the language of psychiatry designed for emergency intervention have a place in explaining what may be one of humanity's oldest and noblest quests for self-realization? In this article, we explore that very intersection. We ask, how can clinicians differentiate between a sacred spiritual emergence and the manifestation of a neurological or psychiatric disorder? In our pages, we journey from the mystical rituals of our ancestors through rich historical narratives and modern neuroscientific insights to the intimate case studies of contemporary practitioners. Ultimately, we propose an integrative approach that honors the depth of human consciousness while safeguarding mental health. From ancient mystics to modern clinics in early civilizations, extraordinary inner states were not symptoms to be erased. They were signs of a deep connection to the divine. Over time, however, the rational lens of Western medicine reinterpreted these experiences. Now, as psychology meets quantum physics and neurobiology, there is an increasing call for a synthesis that respects both the mysteries of the spirit and the necessities of modern care. Our inquiry unfolds over a series of sections. We begin with historical perspectives on mysticism, then examine the core practices and phenomena of Kundalini meditation. Next, we contrast these ancient experiences with the clinical criteria for psychosis. We then present detailed case studies that illustrate the delicate overlap between visionary awakening and mental disturbance before considering alternative therapeutic approaches and the future of Tompro. Integrative psychiatry. Throughout, we stress an essential question. Is it possible to embrace our inner illumination without losing our grip on reality? Historical perspectives, mysticism through the ages, mysticism in antiquity, from the flickering torchlight of prehistoric caves to the golden scriptures of India, the history of mysticism is as old as a civilization itself. Early humans several millennia ago engaged in shamanic rituals, dance, drumming, and the purposeful induction of altered states to commune with spirits and seek healing. The vivid cave paintings in Europe testify to these extraordinary experiences as living accounts of encounters with a greater reality. Ancient texts, such as the Upanishads and the Bhagavad Gita, describe the stirring of a latent energy, a divine spark waiting to be kindled. In Sufi tradition, beloved poets and mystics like Rumi spoke of a union with the beloved that transcended ordinary sensation, while early Christian mystics recorded visions of heavenly light and guidance. For these cultures, mystical experiences were not anomalies. They were integral to understanding life's ultimate purpose. The transformation in the modern age, by the time of the Enlightenment, rationalism and the scientific method began to dominate Western thought. What surfaced were models that prized calculations over intuition, measurement over myth. Consequently, many phenomena once embraced as sacred were reinterpreted as signs of mental aberration. The wondrous experiences of the mystics were recast in clinical jargon hallucinations, delusions, or neuroses to be treated with medication. Yet even as modern psychiatry sought to normalize the human mind, dissenting voices emerged. Thinkers like William James argued that the deepest experiences of life, those moments when time seemed to stand still and boundaries dissolved, could be healthy if integrated properly. Carl Jung, too, emphasized that encountering the depths of the unconscious was a vital part of individuation, a process essential for reaching wholeness. The Enlightenment dilemma. Rationalism offered powerful insights, but it also risked reducing the profound mystery of existence into mere data points. When spiritual experiences are stripped of symbolism and context, what remains is a puzzle that can be misdiagnosed as pathology. The essence of Kundalini meditation. Kundalini, the serpent energy in yogic traditions, Kundalini is described as a coiled, dormant power resting at the base of the spine, a serpent in slumber that, when awakened, ascends through the energy centers, chakras, to culminate in spiritual enlightenment. The term itself derives from the Sanskrit kundal, meaning coiled. In ancient lore, the awakening of Kundalini is both a mystical blessing and a profound challenge, a journey that promises liberation moksha at the cost of intense, sometimes overwhelming, inner change. For generations, gurus have passed down rigorous practices to awaken this force safely. With ritualized asanas, disciplined breath control pranayama, mantra chant, and visualization, the practitioner gradually prepares for the transformative surge of energy. This process, when undertaken under expert guidance, can catalyze a radical transformation of consciousness where sensory boundaries dissolve and the individual feels intimately connected with the universe. Practice and phenomena. Practitioners report a wide array of phenomena during Kundalini awakening. Many describe a sudden surge of burning heat or tingling along the spine, sometimes accompanied by involuntary movements known as kriyas. Vivid visions, often symbolic, such as geometric patterns, luminous colors, or allegorical figures, appear during periods of deep meditation. Emotions, too, may intensify. Feelings of ecstasy, profound sorrow, or overwhelming joy can arise as repressed aspects of the self are released. A common refrain among those who have experienced Kundalini awakening is that these sensations open a door to a vast inner landscape, a realm where the usual limits of time and self give way to a boundless, interconnected existence. As one practitioner famously remarked, "Within each of us lies a sacred fire waiting to ignite the universe of our being." While many welcome these changes as part of their spiritual evolution, the intensity of the experience can be unsettling to unprepared minds. In the absence of appropriate support, the same symptoms may appear chaotic, even dangerous, to a clinician trained solely in Western medical paradigms. Modern narratives and neurophysiology of Kundalini. Modern tales of awakening today, the language of mysticism is not confined to ancient scrolls or temple whispers. The modern seeker shares his or her experience through blogs, podcasts, and social media streams. Countless testimonials describe encounters with cosmic beings, ineffable visions, and sudden epiphanies that dramatically reframe the self. These narratives often mirror the symbolic language of traditional texts, underscoring a timeless pattern, an inner revolution that defies easy explanation. One contemporary practitioner writes, "I was engulfed in a vortex of light and sound, a cascade of memories and emotions that broke through every boundary I knew. In that moment, I was no longer just me, but a part of the eternal pulse of the cosmos." Such testimonies echo across cultural and linguistic boundaries, suggesting that the contours of spiritual awakening are universal. The brain on meditation. Scientific inquiry into these phenomena is still in its infancy, yet advances in neuroimaging offer tantalizing clues. Researchers studying deep meditation have observed heightened gamma-wave activity, increased connectivity among disparate brain regions, and modulation in areas governing self-awareness and emotion. These findings point to an altered state of consciousness that, while measurable, retains a profound subjective quality that resists full quantification. While scientific models can trace correlations between meditative practices and neurological shifts, they cannot capture the ineffable quality of what it feels like to awaken. The mystery remains. How does one explain a sudden burst of clarity that transforms one's entire sense of reality? Perhaps, as proponents of contemplative neuroscience suggest, certain mysteries of the mind are meant to be experienced rather than dissected completely. Contemplative neuroscience highlights increased gamma oscillations during deep meditation, enhanced integration between emotion and perception centers, indications of long-term neural plasticity in seasoned Tao. Practitioners defining psychosis. Clinical perspectives. What is psychosis? In modern psychiatry, psychosis is defined as a detachment from reality characterized by symptoms such as hallucinations, delusions, disorganized thought, and impaired functioning. Diagnostic manuals, e.g., the DSM-5, set forth criteria that help clinicians identify conditions like schizophrenia, bipolar disorder with psychotic features, or substance-induced psychosis. Hallucinations may include auditory or visual phenomena without external stimuli, and delusions are firmly held beliefs that conflict with shared reality. The primary clinical objective in cases of psychosis is to restore reality testing and mitigate potential harm. Medications, particularly antipsychotics, are often used to reduce symptomatic intensity, alongside supportive therapies to help patients reconcile their experiences with everyday life. Clinical criteria challenges. However, the diagnostic process faces challenges when extraordinary sensory experiences emerge within a context that is culturally or spiritually sanctioned. For instance, a person who vibrantly describes encounters with ineffable light or hears mysterious voices might be immediately flagged for psychosis. Yet, without contextual evaluation taking into account the individual's cultural background, history of spiritual practice, and personal narrative, the same phenomena might be misinterpreted. This is not a mere academic debate. Misdiagnosing a healthy spiritual emergence as psychosis can lead to unnecessary and potentially harmful treatments, including over-reliance on medication that suppresses rather than integrates the experience. In today's pluralistic world, it is increasingly important for mental health professionals to approach such cases with cultural sensitivity and an awareness of the broader spectrum of human consciousness. The overlap: spiritual experiences versus psychosis. When the sacred resembles the pathological at first glance, the phenomenology of a Kundalini awakening, vivid visions, auditory phenomena, profound emotional shifts can resemble the symptoms of Ash-Kur. Clinical psychosis. In some cases, individuals report seeing figures, hearing voices, or feeling sensations that parallel the diagnostic markers of schizophrenia. The overlap is striking enough that, when isolated from their spiritual context, these experiences may trigger alarm bells in a busy emergency department. To disentangle this overlap, clinicians must look at the surrounding context. Was the experience precipitated by months or years of meditative practice, or did it arise suddenly in the wake of trauma or stress? Is the individual able to reflect upon their experience, questioning its implications and integrating its insights? Preliminary studies suggest that when a person maintains reflective insight even amid overwhelming sensory input, the experience is more likely to be adaptive rather than purely pathological. Key differentiators. Cultural sensitivity. The following factors are critical in distinguishing a transformative spiritual emergence from psychosis. Context. Spiritual experiences often occur within a framework of intentional, ritualized practice. Insight. A reflective attitude toward one's visions or emotions is usually preserved in spiritual awakenings, as opposed to the fixed, unyielding beliefs seen in psychosis. Duration integration. While intense and sometimes disrupted in the short term, mystical experiences tend to be cyclical, peaking and then gradually integrating into one's everyday life, whereas untreated psychosis tends to deteriorate steadily. Response to grounding techniques. Individuals experiencing a Kundalini surge may find relief through meditation, grounding exercises, or even creative expression, suggesting that the underlying phenomenon can be integrated into a healthy life narrative. Key differentiators. Purposeful context versus random onset reflective narrative versus fixed delusion. Cyclical integration versus progressive deterioration improvement, with grounding versus reliance on growl. Medication in-depth case studies. Part 1 case study. Rosita's Awakening. Rosita, a 32-year-old dedicated Kundalini practitioner, embarked on an intensive meditation retreat with the aim of deepening her inner awareness. Over several weeks, she experienced a series of powerful phenomena: spontaneous kriyas, swirling visions of cosmic energy, and a flood of emotions that ranged from celestial ecstasy to poignant sorrow. When Rosita began wandering hospital corridors in a state of heightened awareness, local clinicians, unfamiliar with the subtleties of Kundalini phenomenology, provisionally diagnosed her with psychosis and initiated antipsychotic treatment. Following several weeks of integrative therapy combining mindfulness practices, spiritual counseling, and culturally informed psychiatric evaluation, a more nuanced picture emerged. Rather than a pathological condition, Rosita's experience was reinterpreted as a natural, albeit intense, expression of a long-awaited awakening. With respectful guidance and support, she gradually integrated her experiences and weaned off medication, reclaiming her sense of purpose and inner balance. Case study: Jonathan's visionary journey. Jonathan, age 45, had long been immersed in the esoteric traditions of the Rosicrucian order. His journey was marked by vivid, symbolic visions, images of ancient alchemy, archetypal figures, and surreal landscapes that he described in rich metaphorical language. When his family grew concerned at his increasingly abstract communication and occasional withdrawal from social life, a referral for psychiatric evaluation was made. A careful assessment revealed that Jonathan's visionary experiences, while atypical from a conventional standpoint, were deeply embedded in the symbolic language of his tradition. His narrative was not one of disorganized thought, but a coherent, if complex, personal mythology that provided him with transformative insight. Jonathan's case highlights the importance of narrative context and cultural congruence when interpreting unconventional experiences. In-depth case studies. The second case study, Elena and the Gateway Experience. Elena, a 29-year-old participant in the Monroe Institute's Gateway Experience, sought to explore the SIA, boundaries of consciousness, through structured audio-guided meditation. During intense sessions, she reported experiences reminiscent of out-of-body travel and encounters with luminous, otherworldly presences. Initially, Elena's descriptions raised concerns among her support network as they hinted at dissociative symptoms and a potential slide into psychosis. However, when she was provided with integration support, including group therapy with fellow Gateway practitioners, mindfulness sessions to anchor her perception in everyday reality, and guidance from a transpersonal therapist, Elena's experiences gradually began to align with a model of transformative awakening. Her journey demonstrates how, with proper framing and support, even the most disorienting mystical experiences can metamorphose into wellspring of creativity and inner strength. Case study: Marcus and remote viewing. Marcus, an experienced remote viewer engaged in government-backed psychic phenomena research, consistently demonstrated extraordinary intuitive insights. His sessions, characterized by precise and verifiable descriptions of distant events, occasionally bled into everyday life. Concerned acquaintances initially feared that Marcus might be developing a form of psychosis. However, a detailed assessment revealed that Marcus operated within a highly structured framework, voluntarily entering and exiting altered states with clear awareness and control. Through dedicated grounding practices and periodic evaluations with an integrative specialist, Marcus was able to harness his abilities safely. His case further underscores that when extraordinary perceptual capacities are cultivated in a supportive context, they need not devolve into pathology, but can be harnessed as sophisticated cognitive skills. Alternative integrative therapeutic approaches. Mindfulness-based therapies. Modern clinical practice is increasingly embracing mindfulness as a tool for integration. Techniques such as Vipassana meditation, mindful movement, and targeted breathwork offer individuals a way to ground intense inner experiences. These methods foster present-moment awareness, helping individuals observe and contextualize their visions and emotions, rather than becoming overwhelmed by them. Empirical research supports the benefits of mindfulness, from reducing anxiety and depression to enhancing neuroplasticity and emotional regulation. Holistic and transpersonal psychotherapy. Beyond mindfulness, holistic psychotherapy broadens the therapeutic landscape by integrating body, mind, and spirit. Transpersonal psychology, in particular, invites clinicians to reinterpret mystical experiences as transformative milestones in the journey toward wholeness. By incorporating modalities such as somatic experiencing, energy work, Reiki, Qigong, and group therapy, practitioners are better equipped to help patients weave their extraordinary experiences into the prada fabric of their everyday lives. Therapeutic tools for integration: breathwork and progressive relaxation, somatic experiencing and body awareness, group sharing and peer support, art therapy and creative expression. The future of integrative psychiatry, bridging the divide as we face the challenges of a globalized and increasingly pluralistic society. There is an urgent need for mental health systems to evolve. Bridging the divide between ancient mystical traditions and modern clinical practice requires interdisciplinary education, cultural sensitivity training, and research that spans neuroscience, psychology, and religious studies. Progressive mental health centers are already forming interdisciplinary teams that include not only psychiatrists and psychologists, but also spiritual counselors and experts in comparative religion. Such collaborative frameworks provide a roadmap for a future in which diagnoses are nuanced, treatment is individualized, and the full spectrum of human consciousness is honored. Clinicians who embrace this integrative approach recognize that the extraordinary experiences of some individuals may carry the seeds of healing and self-actualization, not the markers of pathology they once presumed. Emerging trends and research directions. Cutting-edge research in contemplative neuroscience is expanding our understanding of altered states. Studies are now uncovering links between long-term meditation, structural brain changes, and improved emotional regulation. Emerging diagnostic frameworks seek to include cultural context, patient narrative, and neurobiological data to form a more holistic view of mental health. An infographic timeline might illustrate milestones from early meditation research through modern neuroimaging breakthroughs, emphasizing that the integration of the mystical and the medical is both possible and necessary. Integration is not about silencing the divine within, but about learning to live in harmony with it. Dr. L. Rivera, Integrative Psychotherapist Reflections, Cultural Insights, and Practitioner Perspectives Reflections on Spiritual Evolution Across Continents and Centuries. The evolution of consciousness has been a common, yet deeply personal, journey. Thought leaders from ancient sages to modern mystics offer rich reflections on the nature of awakening. Interviews with contemporary spiritual teachers and transpersonal therapists reveal that periods of intense inner upheaval can be both painful and profoundly liberating. These reflections urge us to view non-ordinary states not as aberrations to be suppressed, but as emerging facets of the human capacity for transformation. Expert voices affirm that when integrated properly, mystical experiences can unlock hidden creative potentials, mend traumatic ruptures, and foster resilience. They remind us that the path to true self-realization is neither linear nor free from struggle. It is a dynamic interplay between light and shadow, chaos and order. Cultural sensitivity in diagnosis. Diagnostic practices must evolve to account for the rich cultural tapestry of human experience. Cases from indigenous tribes, Eastern philosophy, and modern urban spiritual communities illustrate that what might be considered a symptom in one context is a revered sign of inner progress in another. Clinicians are encouraged to engage with cultural informants, spiritual leaders, and the broader community in order to develop a more inclusive, empathetic framework for assessment and treatment. By embracing a multifaceted approach, mental health professionals and society as a whole can start to celebrate the diverse expressions of our collective consciousness rather than pathologize them. Conclusion: embracing the paradox of transformation, awakening to wholeness. In the final analysis, the question remains: is a Kundalini awakening a sign of a pathological breakdown or a herald of profound inner transformation? The evidence presented here suggests that when seen in context, a deliberate, culturally enriched practice, the intense experiences of spiritual emergence are not a prelude to mental illness, but a challenging, transformative aspect of human evolution. A harmonious future lies in embracing both the spiritual and the clinical. It means understanding that the extraordinary states encountered by mystics are not inherently dangerous. Rather, they are opportunities for healing, insight, and growth. Human beings, with all their complexity, deserve a mental health model that is as multifaceted as their inner lives. The path forward looking ahead, the integration of ancient wisdom with modern science represents not only a paradigm shift but a fundamental reimagining of mental health. With interdisciplinary collaboration, culturally sensitive diagnostic tools, and an openness to the mysteries of consciousness, clinicians and spiritual practitioners can together forge a path that honors the full range of human experience. Our call to action is clear. Let us celebrate the human spirit in all its mysterious, ineffable beauty. Let us continue to research, explore, and dialogue with an open heart and mind, so that the mystical and the medical may walk hand in hand toward a future of true healing and wholeness. Final pull quote. Celebrate the human spirit in all its mysterious beauty, and let us forge a future where the mystical and the medical walk hand in hand. Epilogue. Final reflections. This extensive exploration has taken us on a journey from the ancient mysticism of our ancestors, through the practices of Kundalini meditation, to the modern clinical landscapes of the psychiatry. We have seen that what at first might appear as a simple case of psychosis may in fact be an extraordinary call to awaken a challenge to unlock a deeper, more holistic understanding of the self. As research advances and cultural perspectives broaden, the hope is that our diagnostic models and therapeutic approaches will adapt accordingly, recognizing that the inner realms of consciousness are as worthy of scientific inquiry as they are of spiritual celebration. In doing so, we honor both the sacred lessons of the past and the potential for transformative evolution in the present. Let this article serve both as a call for compassionate integration and as a testament to the resilience of the human spirit, a reminder that the journey inward, in all its complexity, is a path worth treading. Thank you for joining us in this in-depth exploration. May our continued dialogue help bridge the gap between mysticism and medicine, enriching our understanding of what it means to be truly awake.